Supporting fascia health, an overview of causes and recovery strategies. Fascia, the body's vast connective tissue network, plays a vital role in physical support, movement, and structural integrity. While often overlooked, weakened fascia can cause a cascade of issues: chronic tightness, pain, restricted movement, and slower healing. The failure of this connective tissue can lead to serious conditions, such as inguinal hernias in the abdominal wall or pelvic floor dysfunction in the lower pelvis. Whether due to age, dehydration, diuretic medications like bumetanide, or poor nutrition, damaged or dehydrated fascia can significantly affect quality of life. This article provides an in-depth overview of how to support facial health by addressing its hydration, nutrition, mobility, and structural integrity, step by step. Disclaimer: the information in this article is for educational purposes only and is not a substitute for professional medical advice. Always consult with a healthcare professional before making any changes to your diet, exercise routine, or before discontinuing or changing any medication. Understanding weakened fascia. Fascia is a collagen-rich tissue that surrounds muscles, nerves, and organs. It needs proper hydration, minerals, and mechanical stimulation to remain elastic and functional. When fascia becomes weak or sticky, it can create pain, stiffness, and impaired movement. This weakness can lead to a failure in its supportive function, resulting in inguinal hernias, a defect in the facial layer of the abdominal wall, allowing an organ or tissue to push through. Pelvic floor issues, weakening of the fascia and muscles that support pelvic organs, leading to conditions like incontinence or pelvic organ prolapse. The three types of fascia. Fascia isn't a single, uniform tissue. It is a continuous, three-dimensional web that extends throughout the body, organized into layers with specific functions. Superficial fascia, found just beneath the skin, this loose layer stores fat and water, and acts as a protective cushion. Deep fascia, a denser, tougher layer that surrounds and separates muscles, bones, nerves, and blood vessels. This is the layer most commonly targeted in manual therapies. Visceral fascia, this specialized fascia supports and suspends organs, such as the heart and lungs, in their proper positions. Factors that weaken fascia. Chronic dehydration. Electrolyte imbalances, especially low magnesium, potassium. Medications like bumetanide, a loop diuretic, which can cause electrolyte imbalances and fluid loss. Nutritional deficiencies, vitamin C, collagen precursors. Lack of movement or overuse. Chronic stress or poor sleep. Genetic or hormonal factors. Genetics can influence collagen quality, while hormonal fluctuations, e.g., during menopause or pregnancy, can affect facial stiffness and elasticity. At-risk populations, who should pay close attention? While everyone benefits from good facial health, certain populations should be particularly mindful of the strategies outlined in this guide. Athletes, especially those in sports with repetitive motions or high-impact training, are prone to facial restrictions due to overuse and microtrauma. Proper hydration, gentle stretching, and foam rolling are crucial for preventing injury and improving recovery time. The elderly, as we age, fascia naturally loses some of its elasticity and can become stiffer. This can contribute to a loss of mobility and an increased risk of falls. Consistent, low-impact movement like Tai Chi is especially beneficial for maintaining facial glide and joint function. People with connective tissue disorders, individuals with conditions like Ehlers-Danlos syndrome (EDS), have a genetic predisposition to weaker, more elastic connective tissue. For these individuals, focusing on gentle, strengthening exercises, as opposed to aggressive stretching, and a nutrient-rich diet is vital to provide the most support possible for their facial system. Pregnant and postpartum individuals, hormonal changes during pregnancy, particularly the increase in the hormone relaxin, can soften connective tissue, which is essential for childbirth but can also contribute to pelvic instability. Postpartum, focused recovery strategies are key to rebuilding core and pelvic floor strength. Clinical evaluation of fascia health. Fascia health is a critical component of a full physical assessment. Here's how healthcare professionals typically evaluate it. Physical examination. Therapists can assess facial restrictions through palpation, feeling for areas of tightness, adhesions, or thickened tissue. They also observe movement patterns to identify limited range of motion or compensatory movements that suggest facial strain. Movement-based assessments. A professional might ask you to perform certain movements, like a squat or a twist, to observe how your body moves as a whole unit. This helps to identify where the pull of the fascia is causing a restriction. Imaging technologies. In some cases, advanced imaging like ultrasound or MRI can be used to visualize the facial layers and identify specific pathologies, such as a tear or a thickening. The mind-body connection in facial health. Fascia is not an inert tissue, it's a sensory organ richly innervated with nerve endings. It's estimated that there are 3 times as many sensory neurons as motor neurons in facial tissue, making it a critical communication link between the body and the central nervous system. This direct connection explains why chronic stress and trauma can cause the nervous system to tighten the fascia, leading to a protective tension. Practices that calm the nervous system, like meditation and breath work, can directly help release this facial tension. The vagus nerve, a major component of the autonomic nervous system, is particularly important in this relationship. A healthy vagus nerve can help counteract stress-induced facial tension. The 5-step fascia recovery overview. Step 1. Rehydrate your fascia. Hydration is essential for fascia to remain supple and resilient. Think of fascia as a sponge. A dry sponge is stiff and brittle, but a hydrated one is soft and pliable. Drink water consistently throughout the day. Include electrolyte-rich beverages like coconut water or homemade salt lemon water to support cellular hydration. Eat hydrating foods: cucumber, watermelon, celery, chia seeds, and bone broth. Step 2. Replenish nutrients for collagen repair. Fascia is built primarily from collagen. Producing healthy collagen requires specific nutrients. Vitamin C, crucial for collagen cross-linking and strength. Glycine, proline, lysine, collagen-forming amino acids found in gelatin or bone broth. Zinc and copper, essential for the enzyme systems that build collagen. Magnesium and potassium, regulate neuromuscular tension and fluid balance. If you're on a diuretic like bumetanide, supervised supplementation with magnesium glycinate and potassium-rich foods, like spinach, avocado, or sweet potato, may be particularly important. Step 3. Restore facial movement. Fascia responds best to gentle, consistent motion that encourages its natural glide rather than forceful stretching. Qigong, Tai Chi, yoga, low-impact exercises that promote facial glide and circulation. Foam rolling or massage balls, light myofascial release to reduce adhesions. Walking or gentle bouncing, stimulates lymphatic flow and fascia elasticity. Important caution on bouncing: while beneficial for most, bouncing on a mini trampoline or similar surfaces can be risky for those with very weak fascia, an existing hernia, or pelvic floor dysfunction. These activities can increase intra-abdominal pressure and should be introduced cautiously and ideally under the guidance of a physical therapist or other healthcare professional. Avoid aggressive stretching or deep massage that could further damage weakened fascia. Step 4. Use manual or integrative therapies. Hands-on therapies can reset facial tension patterns and support realignment. These techniques work by applying sustained, gentle pressure that encourages the fascia's gel-like ground substance to become more fluid, releasing adhesions and improving movement. Myofascial release therapy. Structural integration, e.g., Rolfing. Craniosacral therapy. Acupuncture. These therapies improve fluid exchange, break up adhesions, and guide healing in chronically restricted areas. Step 5. Sleep deeply and manage stress. Facial repair is most active during deep sleep. Aim for 7 to 9 hours of quality sleep per night. Practice breathwork or meditation to reduce cortisol, a stress hormone that breaks down collagen and contributes to facial tension. Specific pelvic floor stretches and exercises. Since the pelvic floor is a critical area of facial support, here are targeted exercises that promote elasticity and coordination. Diaphragmatic breathing. The diaphragm and pelvic floor work together. Deep belly breathing helps to gently massage and relax the facial tissue of the pelvic floor. Lie on your back, and as you inhale, feel the breath expand your belly, gently pressing down on the pelvic floor. As you exhale, let the belly fall and the pelvic floor gently lift. Cat-cow stretch. This gentle yoga pose helps to coordinate the movement of the pelvic floor with the spine and breath. On your hands and knees, inhale as you arch your back and relax your pelvic floor, exhale as you round your spine and gently contract the pelvic floor. Happy baby pose. This pose is excellent for releasing tension in the hips and pelvic fascia. Lie on your back and bring your knees toward your chest, grabbing the outsides of your feet. Gently pull your knees toward the floor to feel a stretch in your inner thighs. Glute bridges. Strengthening the glutes helps to stabilize the pelvis, which reduces the workload on the pelvic floor muscles and supporting fascia. Lie on your back with bent knees and lift your hips off the floor, squeezing your glutes at the top. A note on Kegel exercises. While Kegel exercises are a popular method for strengthening the pelvic floor, they were not included in the initial recovery discussion for a specific reason. The first step in healing a dysfunctional pelvic floor, which is often tied to facial restrictions, is not always about strengthening but about releasing and restoring the ability to relax. When to wait. If you have a pelvic floor that is constantly tight, hypertonic, or experience chronic pelvic pain, starting with Kegels may worsen symptoms. Focus instead on the gentle stretches and diaphragmatic breathing described above to first release tension and improve blood flow. When to proceed. Once you can consistently feel the pelvic floor relax and release during breathing, and your hips and surrounding fascia have more mobility, you can consider adding Kegels. They are most beneficial for those with a genuinely weak, hypotonic, pelvic floor or those who have successfully released prior tension. Proper technique. Kegels should be practiced with a focus on both the contraction and the full relaxation of the muscles. A physical therapist can provide personalized guidance to ensure you are doing them correctly and at the right time in your recovery journey. What to avoid during recovery. Overstretching can worsen microtears in already compromised tissue. Highly processed foods. These are inflammatory and low in collagen-supporting nutrients. Prolonged sitting leads to facial stiffness and a loss of natural glide. Dry environments, without counterbalancing hydration, this can exacerbate tissue dehydration. Recovery timeline. Recovery phase. Time required. Initial rehydration and flexibility. 3 to 14 days. Collagen and fascia rebuilding. 6 to 12 weeks. Deep tissue remodeling. 3 to 6 months or more. Export to sheets. Consistency is key. Even subtle improvements in hydration, mineral balance, and movement can yield noticeable benefits in fascia quality and resilience. Final thoughts. Fascia is dynamic and remarkably responsive to the right inputs. If weakened, by medications like bumetanide, poor nutrition, or immobility, it can be repaired with a targeted, gentle, and sustained approach. Whether you're looking to prevent a hernia, support your pelvic floor after childbirth, or simply regain your body's full range of motion, the principles of fascial health are your guide. Support your body with hydration, collagen-building nutrients, fascia-friendly movement, and restorative sleep, and over time, your connective tissue can regain its strength, glide, and function. References.